Could you explain how digital medicine, the journey of digital medicine, how has it changed? Maybe how the pandemic has affected digital medicine. Is it effective at actually meeting the needs of the increased demand that the NHS have? Maybe some things that you're working on here in North East London to address that.
So the health technology landscape has hugely changed since the pandemic. So traditionally, pre-pandemic, the healthcare system was always slow to adopt technological change for a variety of reasons. One, due to entrenched biases because people just didn't like change. Two, due to a hesitancy around things like patient data. And thirdly, often it was just cumbersome to to train clinicians on a large scale to use a particular service. Then the pandemic happened, and we had to move from seeing patients face to face to doing telephone consultations. That created an environment which forced GPs to change the way we worked. So it created an environment where we were more open to accepting new technologies. So we saw the development of new asynchronous communication technologies with organizations and great companies like AcuRx, which allows, we saw them emerge, which allow GPs to text and communicate with their patients, which allowed us to get in contact with patients and reduce the footfall in the GP practices. In addition to that, we saw video consulting, which emerged, allowing us to see patients without needing them to come in. And a lot of this came around due to the pandemic. We started to adopt technology in new ways. And with that came a new sort of desire to adopt technology. And we've seen new pieces of technology help secondary care as well. When it comes to, for example, triaging, we're seeing new technologies emerge. As well as the virtual beds, which is the whole idea of virtually managing patients at home who may have been traditionally managed in hospital but didn't technically really ultimately require hospital.
The virtual beds where you get a phone call from a specialist in secondary.
And they sort of monitor, they monitor you at home. Someone may come around, do your observations, and there'll be a digital dashboard. That's something that's taking place. With that, we've also seen now the emergence of transformative new technologies. For example, large language model like things like ChatGPT, which a lot of your listeners would have heard of or been using. And some of those pieces of technology could transform the way in which we manage our administrative burden. So, composing referral letters and things like that, those technologies could potentially be transformative. I've not seen major technological solutions just yet, commercial products come up. I know of startups working on it. In terms of Newham, we've been working in many ways to use technology to support our patients. We've adopted, workforce management, population management tools. Like there's a tool called Edobor Apex, which pulls lots of publicly available healthcare data into a really easily accessible dashboard that allows us GPs to plan our services better. For example, we can look at the dashboard and see that this time last year, we were doing a flu vaccination. We had a huge amount of footfall into the practice. Actually, we need to employ some additional staff just to help with this period. So it allows us really to manage that demand and ensure that the patient has more of a seamless experience when using our service. Another piece of technology that we've seen the rise of when it comes to automated registrations. There's a company called Health Tech One which is doing some great work on that, where it's helping GP practice to save time by reducing the amount of time staff have to focus on doing some of these administrative things. So the NHS is changing rapidly, but one of the things I always am acutely aware of is that with digital transformation in this way, some people can be left behind. So it's very important that we focus on reducing digital exclusion, and that with this pace of this change, we have to look at ensuring that our patients who may not have access to the internet in the same way, that may not have an advanced phone, can still access a GP. And you may have heard of certain cases where some practices may have gone completely to what we call a digital triage model, where patients have to purely do online consultations and they say they can't access their GP, or there's language barriers. So it's really important when we're adopting these new ways of working, we still think about ways
accessibility. Yeah, I think that's fascinating to hear, and that's a question I'm going to ask at all my podcasts for probably the next 5 years, which is, what's the impact of the pandemic on your work? And it's really interesting to hear. I mean, one of my questions I was going to ask, but you've kind of answered it, is why is the NHS slow in making changes? And you say it's partly cultural, but the pandemic in the digital world, let's say, has actually highlighted that. Well, it forced people to change, and then when people went through the change, like, okay, can we still kind of consistently go through that change? And you said it is
exactly
still happening.
And just to quickly just come back on your point on why is the NHS sometimes
I think that's a complaint that maybe people have. They're just slow
to adopt technological change.
Maybe if there's a leadership decision, it doesn't actually change the impact on how well you work or helping a patient.
I'll just be really brief on this point. You know, some people view the NHS as a monolithic organisation, but it's actually very heterogeneous. And for example, you know, the primary care system in North East London in Newham looks very different to Doncaster, and there's different commissioning structures. Commissioning is there, but different structures. So say, for example, you're an entrepreneur who has built a really nice advanced technological product. Say, for example, it's a product which, you know, helps to transcribe consultations, for example. You look at the NHS market and then you're thinking, okay, how do I get this product to GPs so it can help them save time? You look to North London, you're like, okay, they've got a different procurement process there. You look to Cumbria, you're like, oh, I can't really contact anyone there. Then you sit back and you think, actually, I'm not going to invest all this time and money into trying to get this piece of technology because it's a bit complex. I'm going to go to a different market. So it's about us thinking a bit more about that process and how we can make that process more seamless. So it's a really complex question about why, you know, why a system like NHS is slow to adopt change. It's very, you know, there's lots of reasons, lots of answers, but looking at how the process is for someone trying to bring something in it would be helpful.
Right. I think you sharing your experiences about working in Newham and in North London, and also those leadership positions, I think even for those who are listening in a more broader sense, by us going a bit more specific, it allows people to understand it, for me mostly, how does the NHS work, how are decisions made, even on the ground, and also talking through why can some things be slow.